two, you need to identify if the child is breathing normally, or if the child is breathing abnormally, or maybe the child is not breathing at all. This is very crucial to know what you're going to do next. So if your child is...
Hello everybody and welcome to Irene Talks. My name is Dr. Irene and today we are going to be looking at the part 2 of our two-part video on household poisoning in children. Last week we looked at how to recognize some common household poisons, and if you were not able to be here last week, you can always watch our videos on YouTube, on Facebook, to see some of the common household poisons that we have. For those that are watching me for the first time, you're welcome. For those that are returning viewers, you're also welcome. So today we're going to be talking about how to recognize that your child has been poisoned, and we're also going to be looking at how you can help. So I will be giving you guys some first aid tips, as well as showing you guys some signs and symptoms. So let's get into this video. So at least from last week, we can recognize that there are different kinds of poisons. I mean, we talked about so many different categories of poison last week. So you know that poisons come in different forms. Because of that, and also because that your child can be exposed to these poisons in different ways. For example, one child can swallow a poison, another child can inhale it, another child can put it in their eyes. So the signs and the symptoms are different. When I say signs and symptoms, for signs, I'm talking about things that you can see. For example, vomiting. Vomiting, you can see vomiting, so you can say that is a sign. Symptom, for example, is abdominal pain. I can tell you that my stomach is paining me, but you cannot really see that it is paining me. I mean, do you guys understand what I'm talking about? So signs are things that I can see and you can see, and symptoms are things that me or the patient or the person that is suffering the stuff can feel. Let me not get too doctory for you guys. Let's get into this video and you see some common signs and symptoms of poisoning in children.
So some of the common signs and symptoms that we should be aware of are nausea. For example, nausea is when you have the sensation or the feeling to vomit, but you don't actually vomit. Then we have vomiting, we have dizziness, we have pain. You can have abdominal pain, you can have chest pain, you can have pain if the substance poured on the skin and it's burning them, so pain there. Also have diarrhea as a symptom as well. We also have rash. We can have trouble breathing, difficulty breathing. You see that the child is taking shallow breaths, or it's difficult for the child to breathe. They are breathing with their mouth. The next one you can find is coughing, because of the airways are irritated, especially when you have inhaled poison. And then we have drooling. Drooling can appear also in seizures. Now, with all these signs and symptoms, I would like you guys to know that they can also appear in other diseases, not just in poison. But when you see them in your children, remember and think of poison as well as one of the causes of these signs and symptoms. So what can you do when you see these signs and symptoms? And I will suggest you follow the 3 steps that I'm about to give you now. In step 1, you need to know 2 things. 1, is the child conscious or unconscious? When I say unconscious, I mean that the child is not responding to you, the child has passed out. Number 2, you need to identify if the child is breathing normally, or if the child is breathing abnormally, or maybe the child is not breathing at all. This is very crucial to know what you're going to do next. So if your child is unconscious and breathing normally, that is, the first thing you would do is to call your emergency medical helpline. That is your ambulance, or for some countries they have a poison center, so you call your poison center if you have a poison center. And if you don't have any of these, you can call for someone to take you and your child to the hospital. After making that call, then you have to put your child in a recovery position, and this is the recovery position right now. Unfortunately, I cannot explain the whole extent of the recovery position in this video. I can make another video to explain the recovery position, but I will put a link in the description box to a website where you can see step by step how to put a child in a recovery position. Now, if your child is unconscious and is not breathing or breathing abnormally, it is important for you to call for help. Again, you can call your emergency medical helpline, you can call your poison center, you can call for the ambulance, or you can call for someone to take you and your child to the hospital. But before they arrive, it is very important that you start CPR. CPR stands for cardiopulmonary resuscitation. That is, you are trying to spontaneously help. You're trying to help revive the blood circulation in your child's body. And it is important for you to do this until help comes, until the ambulance comes, until the person that is supposed to take you guys or until you get to the hospital, until medical help comes, or until the child comes back, is resuscitated, until the child regains consciousness. Unfortunately, again, I cannot add that video in here. I cannot show you how to do a CPR in this video, but I will put a link to a website that shows you how to do a CPR step by step. But if you would like me to show you a video on how to do CPR, you can leave a comment in the description box. So I know step 1 was very intense. However, it's important for us to go to step 2 right now. Step 2 is equally as important as step 1. And this is where you have to try to identify the route of exposure, and also, if possible, the substance that the child was exposed to. So when I say identify the route of exposure, I mean you should try to find out if the child swallowed the substance, if the child inhaled it, if the child if it entered the child's eyes, or if it poured on the child's skin. Depending on what you find out in step 2, we move to step 3, which I call the action step. So if you suspect that your child swallowed something poisonous, don't force them to vomit. Don't put your finger into their throat and force them to vomit the substance unless a doctor tells you to. Remember to rinse their mouth so that in case there's any left particles of what they swallowed in their mouth, it will come out. If they swallowed something that is burning their throat or irritating their throat, you can give them some small quantity of water or milk to drink. Always remember to call your poison center, your medical helpline, emergency, to find out what to do and how poisonous the substance is that they took. If you notice that their symptoms are very serious and the condition of your child is very serious, don't wait. Rush them to the hospital. So if you suspect that your child inhaled some poisonous substance, maybe they inhaled a very strong cleaning product, the first thing you should do is take them to fresh air. Take them away from that smell, from that product. Loosen their clothes so that they can have more room to breathe. Open the doors and the windows so that you can ventilate the place. The point is to get as much fresh air as possible. And always remember that don't put yourself in harm's way except you have proper equipment. Don't rush into some kind of, fumes without covering your nose with proper masks. Have that in mind. If you suspect that poisonous substance entered into the eyes of your child, then rinse the child's eye for at least 15 minutes. I suggest you do it under a tap, or you use some form of jug or something. Don't just splash the water into the eye. Remember not to use any eye drops, because so many people have used eye drops in their house and they just tend to use them whenever they feel that they have eye problems. Please do not do that. If you notice that after 1 hour the child's eyes are tearing up or it's swollen, please rush the child to the emergency. You do not want your child to lose their sight over something like this. Finally, if you notice that your child, let's say a very harsh chemical poured on the skin of your child, it is very important to immediately rinse that place with room temperature water. If it's in a large area, you can just go put the child in the shower, hop into a shower with the child and rinse that place. Do not use soap. Rinse with just water. Remove all the contaminated clothes, that the clothes where the substance might have also poured on. Just remove all the clothes, rinse the parts of the body with room temperature water for at least 15 minutes. And always remember to call helpline if necessary. And if you notice irritations, go to see the doctor.
So that will be all for today. I hope you guys enjoyed this video. Remember to always call for help. Always try to have your emergency contact numbers, like your ambulance number and all of that, with you at all times. Remember to like, subscribe and share this video with your friends and your loved ones and your colleagues and everybody. Just share this video. And if you found this video helpful, remember to like this video. Till next week with more juicy stuff. If you have anything that you would like me to talk about, please leave your comment in the comment section. And for the information I told you about, like CPR, recovery position, and also a link to a poison website where you can help you identify poisons, all that will be in the description box. So look at the description box below.